In this video clip, we're going to look at a potential rehab setting. And what we're going to do is we're going to examine how well we can work on the skills that are necessary to prepare a patient for weighted standing transfers. It is key that that patient have trunk control and sitting balance. And so by putting the patient in a sling and attaching them to the ceiling lift, we can work with that patient on gaining those skills. The entire time the exercise activity goes on, the therapist's hands are free to work with the patient. In old practice, the therapist's hands would be used to bear the weight of the patient, to stabilize them and hold on to them. A second therapist may sit behind the patient and balance and hold the trunk upright. This is a true example of a safe patient handling therapy session, and it's a clean example of how a patient can gain skills without manual exertion. In this example, if the patient wasn't ready to hold themselves upright due to endurance, the sling will catch them and you won't have a patient injury. You also will notice that a therapist didn't have to balance their weight and hold them upright. So a simple fall backwards is caught in the sling and not by the therapist's hands. In this video clip, you're going to see how the limb straps can be used in a rehab setting. We talked about using them for wound care and catheterization, but now if you have a patient who has circulatory issues, the limb strap is very helpful in those scenarios. With the limb strap in place, the patient can have the exercise that they need with reduced pain and reduced effort. Of course, as the patient improves and becomes stronger, more of the exercise comes from them and less from the need of the limb strap. The limb strap can be attached once again to your ceiling lift or your floor lift. The patient is cued to follow certain exercise commands. This could be done by the range of motion aid or the therapist. The benefits to the patient are that increased movement and improvement in circulation and joint mobility. For the healthcare worker, often the limb is held and the weight of the limb is held by that healthcare worker, and it could be up to 60 pounds. So when you look at the benefits to the patient, they're clear. And when you look at the benefits to the healthcare worker, they're clear. One of the things that we find is that the patient reports that it is comfortable and that they feel that they are involved in the exercise in a more comfortable way. Patient is cued to follow simple commands. The leg is supported by the limb straps, and the initial lifting of the leg is done by the overhead lift in this example, but once again it could also be done by the floor lift. The ability to get a patient mobile and moving is not only a therapeutic intervention, but it's also a rehab nursing intervention, and a very important one. A common practice in hospitals and nursing homes is applying pressure stockings or pressure hose to a patient or resident. It can be a very manual and very exerting job. What you're seeing here is a typical garbage bag, and you can see that Bob's cutting that garbage bag, the end of it, top end of it, and he's going to use that garbage bag to apply the pressure hose. This job can be very repetitious. If you have several patients that you have to don and doff the pressure hose, you can see that it could be a difficult job. Anyone who's done it knows that it is. So here's a quick and easy little technique you can use in a safe patient handling environment that will relieve that type of exertion. The bed's up nice and high for good body mechanics. The knees of the bed are elevated to bring that leg up and closer to you. The pressure hose stocking and the plastic bag that is cut are all you need. It's placed on the bottom of the patient's foot. If the patient or resident can help you, have them hold it. The stocking is now going to be placed from the foot end over the plastic bag. And your plastic bag is acting now as your non-friction sheet. With that friction reduced, the stocking is going to slide and glide right up the plastic bag. Quickly, your pressure relief stocking is in place. Good body mechanics were used. And now the bag is pushed behind the leg, up, over, and out. And the stocking is in place that simply. What you're going to see us use in this video clip is what we call limb straps. We're going to use a ceiling lift to attach the limb straps. You can also use a floor lift, but in this clip you're going to see the use of a ceiling lift. Limb straps are used to unweight a limb, lift a limb, and sometimes you can turn in position with them. In this clip, we're going to show you how we're going to use 2 limb straps to raise the lower portion of the body, holding both limbs in the air. A limb could weigh up to 60 pounds. When you're doing a catheterization, or if you're lifting the lower limbs to place a bedpan, you might be doing a treatment or wound inspection. Sometimes the patient needs to be in a position with the limbs higher than the heart. This type of positioning is easy to accomplish, and you can see that there is no effort and no exertion. A very useful tool in a safe patient handling environment, and one that is replacing where the caregiver often had to hold and maintain holding of the limb during care or treatment or catheterization. This is a useful tool even if the patient is not bariatric. Patients and residents often report to us that it's a comfortable procedure, and it's more comfortable than when they feel the caregiver holding their leg. So you can see the benefit to the employee and to the patient resident. What you're looking at is the use of a floor lift or full mechanical lift to achieve the same procedure you saw with the ceiling lift. The full mechanical lift is used to raise the lower limbs using limb straps. With the patient in bed and the caregiver positioning that patient and not transferring that patient out of bed, you could set that patient up for a procedure with one assist. You easily slide the limb straps underneath the knee and attach them to the lift. With a push of a button, the limbs are raised. If there's going to be care and treatment that involves 2-person, then this is just the setup, waiting for your second assist to do the procedure. Once again, a floor lift or a ceiling lift can be used with the limb straps.